Hello, I'm Dr. Corey Lessner, Medical Director at Millennium Laser Eye Centers, and I'd like to take this opportunity to thank you for choosing our facility for your laser vision correction experience. This orientation video is designed to guide you through the procedure process and review the contents of your Millennium folder entitled, "Now That You Know What LASIK Can Do For You." Over the course of the next 15 minutes or so, we will review pre-procedure instructions, post-procedure medications and activity guidelines, what to expect on the day of your procedure, and review the informed consent documents. Although not necessary at this time, you may want to have this folder along with you to follow along. We will first discuss pre-procedure instructions. This document can be found in the right-hand side of your folder. Please arrive at the center promptly at your scheduled time. If you're running late, please contact the center. Wear warm, comfortable clothing. Please bring your consent folder and forms with you to the center. Do not sign the consent forms in advance. There are no restrictions on eating, drinking, or taking medications before the procedure. However, alcohol and medications which may produce drowsiness should be avoided. You should anticipate being at the laser center approximately 2 to 3 hours. There must be someone with you to drive you home. You will not be permitted to drive yourself. Carefully remove all eye makeup and do not wear earrings. Please use a fragrance-free soap and avoid the use of colognes or perfumes, as they can affect the optics and proper functioning of the laser. Millennium or your eye doctor will prescribe antibiotic eye drops, which should be started on the day prior to your procedure. You will also be given a prescription for a steroid eye drop that you will not start until after your procedure. Item number 10 reviews contact lens removal instructions. Understand that these are minimum recommendations, and more time out of your lenses may be required to produce stability in your prescription. Next, we will review LASIK post-procedure care. Please locate this document and follow along if you have it readily available. You will be treated with 3 eye drops following the procedure. The first is an antibiotic drop designed to prevent infection. The second drop is a topical steroid used to control the healing process. It appears milky white and must be shaken well before each use. As previously noted, Millennium or your eye doctor will give you a prescription for these drops. Both of these drops are to be used every 2 hours while awake for the first 24 hours, then 4 times per day for an additional 4 days. The last drop is for lubrication. These should be used frequently while awake for the first 24 to 48 hours. After this time, you will use as directed by your doctor, but still continue using them. Use only preservative-free artificial tears. Please be extremely careful not to touch the eye with the tip of the dropper bottle. If you experience any side effects, such as nausea or hives, following use of the drops, discontinue them and notify the center as soon as possible. In addition to the drops already mentioned, a small vial of proparacaine, a topical anesthetic, will also be found in your post-op kit. These are the same drops that are used to numb your eye during your procedure. 1 drop every 30 to 60 minutes, if needed, should completely relieve the 2 to 6 hours of discomfort that patients may feel. When not used, patients may experience symptoms of foreign body sensation, stinging, burning, or tearing. Any discomfort is typically mild and short-lived, resolving spontaneously as the flap edge seals. If desired, an oral pain reliever, such as Motrin, aspirin, or Tylenol, may also be taken and will almost always be adequate. Do not rub your eyes under any circumstances for at least 1 month following LASIK. Protective eye shields will be provided to prevent inadvertent bumping of your eye at night. If possible, these should be worn while sleeping for the first week following the procedure. You may take a shower or bath, but avoid getting water in the treated eye or eyes for 1 week. Avoid water sports, swimming, hot tubs, ocean and lake water for 2 weeks. Avoid gardening and other environments that are not clean during the early post-op period as well. Wear safety glasses for contact sports and work as indicated. No eye makeup should be used for at least 1 week following treatment. Do not operate a vehicle yourself for the first 12 hours following your procedure or until you are certain that your vision is adequate. Next, we will review what to expect on the day of your procedure. Upon your arrival at Millennium, you will be asked to sign in at the front desk and review for accuracy your patient registration form. You will also be given a name badge to wear. It should be worn around your neck and remain visible at all times. After completing any remaining paperwork, one of our technicians will meet with you to capture several sophisticated color images of your eyes and perform any final preoperative measurements that are required. They will also review the contents of your post-op kit with you before escorting you to the pre-op area. It is at this time that you will meet with your surgeon to discuss any remaining questions and sign your consent forms. Although no longer given routinely, an anti-anxiety medication such as Xanax or Valium is available upon request. Please do not take these medications if you have remaining questions, since doing so may invalidate your consents and prevent us from proceeding with your treatment. In addition, if you know that you have numerous questions, it may be best to contact the center in advance to help avoid delays on the day of your procedure. In this way, we can ensure that we have addressed any issues you may have to your satisfaction. Next, we will escort you to the pre-op area where your eyelids will be cleansed with a betadine solution and a hair bonnet put in place. You will next be brought into the surgical suite for your all-laser LASIK. You will spend approximately 10 minutes in this laser vision suite where the technicians will confirm your name, date of birth, and treatment plan prior to positioning you under the laser. A piece of surgical tape and a shield will be placed over the eye that is not being treated. Drops are used to completely numb your eyes. There are no needles or injections. You will be asked to focus directly above you in the center of the ring of light in the microscope. An eyelid holder, called a speculum, is inserted into the eye, being treated to prevent blinking. This device will not cause any discomfort. A suction ring is then positioned on the eye to hold it in place and facilitate delivery of the femtosecond laser flap treatment. The pressure sensation created by this ring is typically mild to moderate and will cause your vision to fade out during the 30 seconds or so it takes to complete this maneuver. The actual treatment time to create the flap on the FS200 is only 6 seconds. On Intralase, which is preferable for some patients, the actual treatment time is approximately 22 seconds. We will talk to you while you are in the dark so that you can keep track of your progress. During this time, you will also be encouraged to keep your eyes open as wide as possible, since squeezing against the lid speculum will increase the sensation of pressure one feels. When the flap creation is complete, the ring is removed. If both eyes are to be treated, the process is repeated in the fellow eye. Patients commonly report feeling a bit more pressure during the treatment of the second eye. This is normal. With both eyes treated, the second step of the all-laser LASIK is the laser sculpting portion of the procedure. You'll be able to blink normally in between, but your vision will be extremely blurry since you'll be looking through a wall of bubbles. Marks are placed on the eye to facilitate the exact repositioning of the flap. After hearing the sound of the laser during an internal test, your eyelashes will be taped and the speculum reinserted to prevent blinking. The flap is then lifted to deliver the laser treatment. Your job will be to focus on the green blinking light, even though it will appear very blurry and diffuse. The laser itself makes a rapid tapping noise, and most patients will notice an odor similar to that of a singed hair. Typical laser times range from 2 to 30 seconds, depending upon the level of your prescription and the type of procedure that is being performed. Following the treatment, the flap is floated back, carefully realigned and secured in place without the need for any stitches. The entire procedure is then repeated if the other eye is being treated. Immediately after the procedure, when you sit up, you will notice that your vision is improved but somewhat foggy, as if someone had put a thin coat of Vaseline on your glasses. Fortunately, visual recovery is rapid, and most patients see significantly better even before they leave the center. Most can see well enough to drive by the very next day. After leaving the laser suite, you will be escorted into an examining room where we will check your vision and perform a final microscopic examination of the eye. You will then be escorted back to our front desk where you will be given your medication bag in exchange for your name badge and released to go home. We will now review the informed consent document. It is our goal to fully inform you about the alternatives, benefits, and potential risks associated with LASIK procedures. It is impossible to have any form of procedure without accepting a certain degree of risk and responsibility. Our consent is designed to enhance your understanding of the potential issues that may be encountered during your procedure and the healing process. The document is divided into 10 sections. After reading each, you will be asked to initial in the space provided. We will outline the highlights of each section. However, after viewing this video, you should carefully reread this document. Please follow along now with your copy and feel free to pause the presentation at any time. Section 1 contains an introductory paragraph and general information about the approved U.S. Food and Drug Administration indications for the various lasers found in our centers. Section 2, How the Eye Works, reviews the definition of nearsightedness, farsightedness, and astigmatism. If you are over the age of 38, you will be given an additional consent form entitled Monovision and Mini Monovision. This consent form addresses the subject of presbyopia, or the start of reading difficulties, which begins to occur in people sometime after their 40th birthday. It is very important that your eye doctor discusses this condition in detail with you. Many nearsighted people over the age of 40 who take off their glasses to read do not understand that they will need glasses for near work or reading after this procedure. Be sure that you fully understand this condition before proceeding with LASIK. Also in this document, the strategies of monovision and modified monovision are discussed. Once again, where appropriate, these options should be thoroughly discussed with the staff at Millennium or your eye doctor before proceeding with LASIK. Section 3 includes discussions about surgical and non-surgical vision correction alternatives. Section 4 reviews guidelines for the removal of lenses prior to your exam and procedure if you are a contact lens wearer. Section 5 lists conditions that, if present, may prevent individuals from being candidates for laser vision correction. Section 6 is a written recap of a previous section of this video and describes what to expect on the day of your procedure, as well as the steps of the LASIK procedure in detail. Section 7 also recaps an earlier portion of the video and reviews post-procedure medications and restrictions. The next section reviews potential risks and complications of LASIK. The risks of LASIK can be broadly defined in two primary areas: vision-threatening and non-vision threatening. In general, there's about a 1% chance of experiencing some form of side effect or complication, either during or following your procedure, but the risk of experiencing a sight-threatening complication are less than 1 in several thousand. If one of these occur, it is possible that there could be a loss of some or all of your useful vision in the affected eye. The primary causes are untreated or resistant ocular infection, irregular healing with loss of best corrected visual acuity, wrinkled or misaligned corneal flap, malfunctioning of the microkeratome creating an irregular flap. Please note that these risks pertain to flaps created with the microkeratome only and not those having flaps created with the femtosecond laser. Again, these conditions are exceedingly rare and can usually be avoided or managed to prevent marked visual loss. More commonly, patients will experience one or more non-sight-threatening side effects. They are typically short-lived and improve over a period ranging from a few days to several months. I will review in detail the more important points. Discomfort. About 30 minutes following the procedure, as the topical anesthetic begins to wear off, most patients experience some mild to moderate discomfort or pain that lasts from 2 to 6 hours. The sensation is often described as a burning or stinging sensation and may be accompanied by tearing. This brief period can be adequately managed with the use of topical anesthetic drops, with or without a mild pain reliever. Closing the eyes and resting for an hour or two will also typically bring relief. Blurry vision. During the first few days following the procedure, vision may be blurry. Uncorrected visual acuity typically stabilizes within 3 to 4 weeks following the procedure, with full stabilization reached by the 3-month mark in most patients. During the healing period, some fluctuation in vision may exist. The healing process is very much individualized and varies from patient to patient. Abrasions are probably the most common yet least appreciated side effect that occurs during LASIK when the microkeratome is used for flap creation. The mechanical action of the keratome as it glides across the surface of the eye has the potential to rub off some of the surface cells of the cornea. In some individuals, this cell layer has poor adherence. When an abrasion occurs during LASIK, it should not prevent you from having an excellent result. However, it can limit visual function for several days to weeks as the abrasion heals. If an abrasion occurs in the line of sight, your surgeon will typically not proceed with treatment of your second eye until you are comfortable with the vision in your first. When it does not involve the line of sight, you may have both eyes treated. However, there may be more discomfort. In these instances, additional comfort drops are typically given. It should be noted that this risk pertains primarily to flaps created using the microkeratome, since the potential for abrasions is all but eliminated when bladeless technology is used. Dry eye syndrome is probably the most common postoperative side effect. It is very common for all patients to experience some dryness after the procedure. As a general rule, the dryness lasts 1 to 3 months, but may last longer in some individuals. This condition is typically managed with frequent use of preservative-free artificial tears. When more severe, plugs are inserted to temporarily close the outflow drain for the tears found on the medial aspect of your lower eyelids. If you have a history of dry eye syndrome, several tests will be performed during your evaluation to determine its severity. This condition is one of the reasons that bladeless technology, femtosecond lasers, became preferable to bladed technology, since the flap created is smaller and thinner and the hinge position can be customized. All of these features serve to spare more of the corneal sensory nerves responsible for reflex tearing. If dry eye is severe, however, surface treatments may be preferable. Residual prescriptions. These may take the form of undercorrections, overcorrections, or residual or induced astigmatism. There is no guarantee that, for a particular patient, LASIK will be successful in providing the desired level of vision correction. The chance of being undercorrected increases in cases where a higher amount of prescription is being treated. Conversely, in some cases, there's an overresponse to the treatment resulting in an overcorrection. Fortunately, these overcorrections and undercorrections are anticipated in a small percentage of cases and are usually amenable to fine-tuning, otherwise known as an enhancement. Enhancements are usually not performed until vision has totally stabilized, typically about 3 months after the original procedure. These treatments are almost always performed by relifting the existing corneal flap. Assuming that your surgeon or doctor told you that you'd have enough tissue remaining to perform additional surgery, you should be able to wear corrective lenses for driving, close work, or other activities until the time of your enhancement. Corrective lenses may still be necessary for good vision and may also continue to be necessary for certain activities if an enhancement is not possible. Again, because the femtosecond laser allows for the creation of a thinner, more exact corneal flap, patients who have limited amounts of corneal tissue for their treatment will have more tissue available for an enhancement. In some patients, the vision correction effects of the procedure diminish several weeks to months after surgery. This phenomenon is called regression. Regression is more common in patients who are very nearsighted and is in fact expected as part of the healing process in farsighted patients. In some, but not all cases of significant regression, another LASIK procedure may help to remedy the effect. Diffuse lamellar keratitis, also known as sands of Sahara, is an inflammatory reaction that takes place under the flap in about 1 in 250 patients. Unlike the case of infection, patients do not typically have pain and redness. Symptoms include a decline in vision accompanied by increasing light sensitivity and usually occur from 48 to 72 hours following the procedure. If you experience these symptoms, you will be asked to contact the center or your eye doctor so that you can be seen. Loss of best-corrected visual acuity may occur. Most cases, however, resolve completely without any evidence of past inflammation. Visual irregularities such as light sensitivity, glare, and halos. Some patients may be more susceptible than others to experience night vision difficulties such as halo around lights, glare, and ghosting. These symptoms are usually caused by corneal irregularities and may be related to pupil size. Halos are specifically caused when the pupil is larger in dim lighting than the area treated by the laser in the center of the cornea. The higher the prescription, the smaller the effective area of treatment and the greater the potential for halos. If halos persist following LASIK and are problematic, you may get some relief with the use of an eye drop that can be used on a daily basis to help make your pupils smaller. These symptoms usually diminish with time and typically resolve completely by 3 months. In rare cases, they may be permanent. If you are already experiencing these symptoms at night with your contacts or glasses, you should expect them to continue after your LASIK procedure. LASIK may be used to create monovision, a strategy in which one eye is left or made slightly nearsighted to allow for some mid-range and near vision in combination with distance in the fellow eye. This will be demonstrated to you at the time of your exam if it is a treatment option. If you are over the age of 38, you'll be asked to complete a monovision and mini monovision consent addendum. This section goes on to discuss a few more considerations and uncommon conditions. You may choose to pause the presentation now to read these or make sure to review them prior to signing this page. Section 9 reviews the potential benefits of LASIK, and the 10th and final section contains a series of acknowledgments designed to confirm your understanding of the entire process, your expectations, and our commitment to providing you with the best vision correction experience possible. I hope that you found this video informative and educational. If you have any questions regarding the consent form or any of the other information discussed, please ask your eye doctor or call Millennium. We know that your eyes are precious, and we look forward to providing you with a level of care and service that exceeds your expectations. On behalf of the entire staff at Millennium Laser Eye Centers, we look forward to working with you.